Hello, everyone. Thank you for joining us again on another one of these Dunes Eye Consultants live events. Nearly one quarter of U.S. households include someone who suffers from migraines or chronic headaches. No one is immune. About 18% of American women, 6% of men, and 10% of children experience migraine headaches that disrupt work, school, other activities. I mean, it's a really big issue, and there's a lot of different options out there. Like you'll hear ads on TV or on radio, Spotify, things for shots, pills, and none of those. There's a lot out there that don't offer treatment options that treat the root cause. They'll treat like the relief, but they won't treat the main thing. So today we'll be talking about Dunes Eye Consultants Headache Management Center that offers a viable, non-invasive, which means no shots, pills, surgery, or side effects, a non-invasive treatment option that corrects the underlying cause of the headache that addresses the symptoms. And we have a great guest today. We got Dr. Tauhni Hunt from Siouxland Obstetrics and Gynecology PC. She's here. She's a patient to tell her story. And I'm going to send it to Dr. Steve Ferguson, the owner and Vision Medical Director at Dunes Eye Consultants and Dunes LASIK Center, to start us off here.
Great. Thank you very much, Mason, for producing and to Kaleidoscope Marketing for all your great work in this. This is the second opportunity we've had to share information about really a novel breakthrough in how we can help patients that have a certain classification of headaches that are caused by something known as fixation misalignment. And we're going to talk about that today. I'm also delighted that we're joined by Andrea Dalton, part of our team that's very instrumental in helping us get successful outcomes with patients. And we're also very honored that Dr. Hunt, who is a partner at Siouxland Obstetrics and Gynecology, who's also actually a neurolens wearer, and she's going to share her information and stories a little bit about how she's had some success in this management. But let's talk quickly about headaches. One of the things I tell patients is that what we're talking about today is not 100% cure for all headaches. Headaches are subclassified traditionally in four areas: migraines that have an aura, which means a ringing in your ears or a visual disturbance, and then migraines without an aura, a tension headache, which is just basically the head is just pushing on, and you're just got a tension within the headache, and an interesting subclassification of headaches that are medicine-induced headaches. So medicines that we take can contribute to headaches. And then there's a fifth new subclassification known as trigeminal dysphoria, and that's the headache area that we're going to discuss today. I do want to give you a little bit of background. There's a couple of very key people involved in the early stages of this understanding. Dr. Carol Nelson, a neurologist in Sioux Falls, Dr. Jeffrey Krull, an optometrist in Mitchell, South Dakota. And they laid a lot of the groundwork 6 or 7 years ago in the understanding of the mechanisms of this particular headache syndrome. And so how do I see migraines and headaches affecting lives? Well, the stories range. They range from, I get tired at the end of the day, I'm shot, my eyes are really fatigued, I just want to go to bed, or debilitating. When migraines become very severe, it shuts people down sometimes for a day or two. They can't interact with their kids, they miss events, they miss work, and so it can really be severe. So what happens in a migraine, there's a trigger, and there's an electrical disturbance in the brain. It's kind of like a short circuit is going on. And what that does is it causes alterations in the blood flow. And that's where we get auras, where there's a shutdown of blood flow. And then also the pain associated is with the dilation of the blood vessel. So most of the treatment mechanisms are designed to stabilize the blood flows and try to let people get some relief in that manner. So they're really a reactive treatment. And so that's one of the reasons that it's a difficult problem, because if you don't know the trigger. We're going to talk about trigeminal dysphoria and fixation misalignment and neurolenses as a treatment mechanism. And so what's happening in the neurovisual processing, the eyes are not perfectly aligned, and that's triggering a part of your brain in the trigeminal nerve, which is like a big highway, big freeway of nerves in the brain, and it gets overstimulated and causes these secondary concerns. Mason, could you show us real quick what we mean by fixation misalignment?
Fixation misalignment can trigger a number of significant symptoms. Because we have two eyes, everything we see is a combination of two images fused together by your brain. Each eye captures a clear photo like a camera, and your brain combines the photos, making one single image. This line of communication takes place constantly when both of your eyes are open. When your eyes and brain are aligned, this process happens seamlessly. In some patients, this communication doesn't happen perfectly. While each eye may capture a clear photo individually, if there is a misalignment between your eyes, the brain is forced to manually combine every pair of photos. This constant adjustment continually stimulates your trigeminal nerve, often causing the symptoms of fixation misalignment and trigeminal dysphoria.
That was the clip.
Awesome. And so I think the clip is valuable because it lets us understand that there's this constant realignment going on. Your eyes move maybe 150 to 200,000 times a day in these small movements, and the brain and the trigeminal area is reprocessing that misalignment. And what that can lead to is sort of an overstimulation of that nervous system. And that's where we start getting symptoms of eye fatigue, body fatigue. We have dizziness, we have light sensitivity, we get neck pain, which is crazy because of this disorientation, and then we also get headaches that can range from a pulling feeling, but as we get more and more advanced in this trigeminal dysphoria, where we're not compensating, it can lead to a migraine. So you can have a kind of across the board variance in these type of trigeminal headaches. So we've seen how the eyes are supposed to work, and we saw the graphic of misalignment. And we see that when this is happening in that threshold, everybody's got a little different threshold of pain. And Dr. Hunt could definitely tell you stories about different patients she has of pain levels with individuals. But the bottom line is that threshold gets passed, and all of a sudden the breakdown, and that's when symptoms develop. And so what we use is a very contoured, specialized prismatic lens that synchronizes the eyes so distances we're staying together. And that's a critical piece of the puzzle. As we find the misalignment through a test, we then apply the neurolens prism. And in order to do that, we have to have proper measurements and proper eyewear. And Andrea Dalton in our River's Edge team is going to now talk about the important role that she plays in helping patients get an outcome.
Yeah, so first, when you come over to optical, right before that, you've been sight synced, and that is measuring how well your eyes work together. If they're not working together, our eye muscles need to compensate in order to see a clear image. So when we sight sync, we can see just exactly how much your eyes need to move to see clearly. Sight sync also allows the patient to view how much distance and near misalignment is present. So right after testing is complete, then I can then pull up that image for you to see that. And that's big. It helps the patient really understand what's going on. And then we can start the process to custom design your neuro lenses to help alleviate headaches, neck tension, tired eyes, light sensitivity. So after that, we're going to start looking at the right frame. Choosing a perfect frame is just very important. We don't want to choose something that's oversized or something that's too small that's going to squeeze pressure points. We need to steer away from a frame that has a lot of wrap and curve to it. A lot of my neuro patients are very, very light sensitive, whether it's artificial or natural light. So I have a lot of frames that are really lightweight that come with a polarized clip-on option to help with that photosensitivity. And sometimes I have to tell a patient, hey, that frame's just not going to work due to improper fit. Our end goal is to alleviate all those symptoms. So we're going to work together. My whole team here are pros at picking out the right frame. So we have a lot of different options on special ordering color and size as well.
Great.
That's good right there. Are we ready to transition over to Dr. Hunt's story?
Yes.
And right before we do that, I want to let people know, since we have people watching right now, if you want to leave a comment, if you have a question or anything, we will be answering those at the end. But before we do that, Dr. Tauhni Hunt, do you want to first, can you describe the headaches or symptoms that you suffered and how long you've been affected by those? To just kind of get us started.
Yeah, I've actually had headaches all my life, so I'm not new to headaches. So initially and long ago, you would take medications for headaches, and as new medicines come out, you would try new medications. And it became increasingly clear, and over the last couple of years before I saw Dr. Ferguson, that I was very light sensitive. My eyes were dry, they were painful and tired. We've also started doing more computer work and charting. So a lot of times you make excuses for your eyes. So I'd seen a neurologist, and that's actually how I looped around to Dr. Ferguson. And he started working with my eyes. And I had previously had LASIK, so I assumed that I didn't need eyewear again. And then he introduced me to neurolenses. After that, Andrea's been amazing because she has worked with me consistently and regularly, answered questions to make the fit perfect. And I went from light sensitivity and neck pain and dry eyes to being able to do things that I needed to do without having to worry about that.
That's amazing. And you were kind of talking about those different symptoms there with your headaches and stuff. Before you explored neural lenses, did you have any problems with other treatment options or anything like that?
Well, as I said, I was seeing a neurologist, and I had tried multiple medications over the years, so I had done those, and they may make an impact, but I still had the issue there was a trigger to the migraines, and I really did not want to take medication, so I was trying to get to the root cause. I had gone through physical therapy for my neck, I had gone through massage therapy for my neck, and literally I was just trying to not be on so many medications, and that's when it came to the glasses.
Awesome. Yeah. So would you recommend the Headache Management Center to someone who suffers from migraines or chronic headaches or neurovision symptoms?
I think it's definitely worth exploring. I think it's an extensive workup, and the more they test your eyes, they sort of self-demonstrate back to you why it's working and how it's working. And I think through putting those lenses on and then you take them off, you know they're working. So you take them off, you can see a clear difference.
Yeah. Is there anything else that you would like to share or add? Or Ferguson, I'll let you chime in here.
I would say the whole team was great to work with. And Dr. Ferguson got to the bottom of the cause. Andrea fixes everything after that. And there's little tweaks and adjustments that need to be made, and she's always available to take care of those for me.
That's awesome.
Yeah, I'd like to add, Dr. Hunt she's a very, very good historian. Obviously, she's a physician and understands these mechanisms because that's part of her training. She's a medical doctor, so she understands neuroanatomy and neurophysiology. But she is also one that kind of went through some neuroadaptations, and we've had to sort of tailor her prescription several times to get it to the right sort of endpoint. And I always use this analogy, and it may not be a perfect analogy, but this is somewhat like braces for your brain. We're trying to get that right alignment to stabilize that neurovisual input. And so it requires us to go through a few changes. And it's not like getting a traditional pair of glasses yet. Here's your prescription, go get your glasses. We understand that we get started and then we may have to modify to the endpoint. And that's where our team is very valuable in helping patients and making sure the communication is there. So that we can make sure that we maximize this opportunity. And I think Dr. Hunt made a good point. This is not something that I would go out and say, we're going to fix every headache problem. That's not accurate. But there's a large percentage of folks that have this as a contributing factor to the headache syndrome. You can have various types of headaches, but this is a component that needs to be evaluated to determine if we can help them before medication in many cases.
Yeah. Wow, a lot to think about there, and we kind of went through a lot real quick there. I'm going to look and see if we have any comments here. I got one right here. Is this treatment also available and successful in kids suffering from symptoms as well?
It's interesting. Dr. Mike O'Neill is one of our associate partners here, and he has a very large pediatric and adolescent practice because he's younger than I am, okay? And he is using these very, very successfully in children. And children their neural system is more plastic. I mean, they're very adaptable and they respond very, very quickly. And so absolutely. And I think that is just the tip of the iceberg of how many kids out there we can help. that not only are having headaches, but they're having a little bit of a difficult time sometimes processing information. And in the traditional old world, these folks might try some exercises or therapy to try to make their alignment better. Many times neurolenses automatically snaps it in, which improves their performance in functioning. And sometimes it helps them even in school. We've seen some pretty dramatic results. So it's impressive technology.
Huh, wow. I don't see any other questions right now. Is there anything else that you guys can think of that would be valuable information that we could share or talk about right now?
Yeah, I think a couple things. I'd just like to talk about the company, iBrain and Neurolenses. Okay.
Okay.
If you don't mind.
No, that sounds good to me.
Yeah, can I do that right now?
Go ahead.
All right. One of the things that is unique about Neurolenses as a product is that, number one, when we identify the patient through our workup, that we say, yes, you're going to be helped. It comes with a high degree of sensitivity. We were part of a 20-site study on patient response to Neurolenses. And when we've identified someone through our PRISM trials, it's 96% of patients report that they felt better and are doing better. That's crazy. Now, that means 4% of people, for whatever reason, did not report that. We always tell patients you're the most important person. It doesn't matter if I was a neurologist prescribing a medication to try to provide relief, you're still asking the patient normally how you're feeling, right? So the same thing applies. The patient's the most important person. If for any reason that patient just didn't feel like they gained the success that they wanted, the product is guaranteed. The company has our back, and they will refund all the dollars to us, which we then pass along to the patients. That's a unique opportunity that does not exist normally in any aspect of healthcare. And the reason that we're able to do that is because when I have a chance to work somebody up and identify them and trial them, then I know that there's hardly anyone that's not going to be a success story. And I'm willing to take that risk of my time to let them see if they gain the relief they're looking for.
That's awesome. I think that's a great way to end it if nobody has anything else to add.
You want me to talk about concussions at all in TBI?
If it's applicable, is it applicable?
Well, yes, it is.
Tell me more.
Well, listen, neurolens is one of the things that happens when we have a brain injury, and this is proven. Your eyes are disrupted. There's a disruption in your convergence and your eye teaming, and that many times folks will say, I'm fuzzy, I don't process right, I don't feel right, and they go through neuroimaging and testing, and their doctors that have managed them will say, listen, everything's back to normal as far as structure. There's no damage or there's nothing else that needs to be modified. Maybe they had a brain bleed, but they're left with this quote post-concussion syndrome. And really what that means is the brain has got to sort of figure things out again, right? But many times because the brain has such a high amount of sensitivity to vision input and alignment, a large percentage of our brain's dedicated to that. This, like dropping the computer, it's all off. And you put neurolens to these folks and it restores them back to function. This is a super common element to what we do. And I'm gonna tell you a story. My 88-year-old mother is in assisted living, and she got up to go to the restroom in the evening, and she fell and hit her head, was unconscious for 30 to 60 minutes. So she had a concussion, a TBI.
Jeez.
And so I was visiting with her, for a few months and letting her go through the process of making sure everything was good with her docs. And then she kept telling me, gosh, I just don't feel right. I can't see. And of course, she's elderly, and she may be having a little bit of neurodegenerative problem as well. That's been part of it. But I finally took my stuff up to where she lives. I just evaluated her, and I said, Mom, I'm going to put you in some neurolenses. And it's just helped her a ton. She just is a little bit more back to normal. She can read her stuff. She's just going, I don't know what you did to me. She goes, I don't know what these things are, but I definitely feel better, and I can see it in her. So that's just an example of a personal experience. But we deal with this a lot as far as TBIs, and we can help a lot of folks if they're struggling, 3 to 6 months afterwards and just not getting back to where they need to be.
Huh. Okay, well, we actually have somebody commenting here that says that they have a concussion, and they were wondering about Lyme disease. can neurolens treat that? Is that a
Well, Lyme's disease is an organic problem. Okay, it's an actual disease process that gets in and creates a lot of sort of inflammatory problems. And we see occasionally someone that gets a lot of inflammation within their optic nerve of their eye, for example. It's pretty rare, but you can see that. So the question becomes, has the Lyme's disease affected them in a manner that maybe it's dropped their threshold to be able to compensate for fixation misalignment? So I wouldn't say directly that we're treating Lyme's disease. We may be addressing a secondary problem that the Lyme's disease, the rest of your body, it may have affected as well. The only way to really fully appreciate that is to assess their binocular vision, do a sight sync, and do a trial test to see what their symptoms are. Okay.
Well, I learn something new every day.
Stay away from deer ticks.
I'll try to do that. I don't see anybody else commenting anything, so I think that might wrap it up for today. I want to thank our guest, Dr. Tauhni Hunt. Thank you for joining us, sharing your story. Thanks, Andrea, coming on, talking. Dr. Steve Ferguson, once again, thank you. And thank you to everybody who's watching. And if anybody else has any questions, I would like to send them to duneseye.com. There's a headache management center page where you can go and find out more about treatment options and what all there is. And we actually did another one of these live events a while back with another patient. So if you want to watch that, maybe you can learn something, but that's all I have. Does anybody else have anything else to add?
I'd like to say thank you, Mason, once again. I really appreciate Dr. Hunt taking time out of her busy schedule.
Yeah, thank you.
That's incredibly valuable, and I think the impact of actually having a physician talk about what's going on will help a lot of people. I think they're going to feel more comfortable about maybe approaching this for themselves, and that's going to be just a fabulous thing for us. But I also want to say that this technology is not just us. It's emerging across the country in many, many eye offices. It's taken a while, but now it's becoming much more standardized. So if you have people you know across the country, have them seek out somebody that has a sight sync or neurolens in their practice. And it's just been a fantastic thing. One of the best things I've ever had as a breakthrough in my practice. So thanks again, everybody.
Awesome. Yeah, thank you for watching.